Hi,
Hi.
I'm your student nurse, Jacob Hickson, and I will with the University of Southern Mississippi, and I'll be doing a head-to-toe assessment on you and focusing on your head, neck, eyes, and ears. Can you tell me your name, please, and your birthday?
Sarah Heyman,
Sarah Heyman, and your birthday?
7/15/90.
Okay. Checking it with the ID band. Fits. Checking level of consciousness. Can you tell me what day it is?
Today is Wednesday, December 7th, 2011.
Okay. Can you tell me where you are?
I'm at the School of Nursing at University of Southern Mississippi.
Okay, great. Her general survey is good. She has good posture. She's alert, oriented ×3. So we're going to start off with the vital signs. So I'll start off with the blood pressure. Can I see your arm, please? Alright, 110/62. Okay, and now I'm going to take her temperature. Do you have any pain? Mm-mm. Okay. 96.4. Good. Okay. Now I'm going to take let's see your wrist. I'm going to take your radial pulse. Okay, 72, good. Right, and now I'm going to check your brachial pulse. And while I do that, I'm going to check respirations as well. Her brachial pulse matches her radial pulse, and her respirations are 14, which is the normal limit from 12 to 20. Right, so I'm going to start with assessing your pupils. She'll just follow the light for me. This is also testing the 6 cardinal muscles. Okay, can you follow the kind of finger? Okay, now focus on the wall. Good. Okay, I'm checking her nose for patency. Can you breathe in for me? Good, good. I'm going to put on my gloves. I'm gonna do a general, can I see your ears please? Make sure there's no bumps, lesions, redness. And we'll come back to that when I do my focus assessment. I'm going to have you sit up for me, please. Okay. Now I'm going to check her range of motion for her neck. So we just try to bring your head towards me. Good. Do it on the same side. Good. Head forward. Okay. Head backwards. Good. Good. Now I'm going to check her cranial nerve. I'm going to ask her to shrug her shoulders for me. Good, very good. Okay. Can you stand up for me, please? Okay. Can you bend your spine towards the left like this for me? Checking range of motion in your spine. Bend it to the right. Good. Can you bend it forward? Okay, and backwards. Okay, great. Now can you walk for me, please? And back. Everything's good. You can have a seat. Body symmetric. You can lay down. Her skin color is warm, dry, and it's appropriate for a race. And there's no lesions, redness, edema anywhere on her. So I'm going to assess your abdomen now. Lift up your shirt for me, if you don't mind. I'm going to assess the abdomen. You start off with inspecting it. There's no pulsation, no bounding, and then you move on to auscultation. You're checking the 4 quadrants to make sure her vowel sounds are active and not stopped. Good. Vowel sounds are active in all 4 quadrants. Okay, I'm going to tell me if you feel any tenderness at all.
Nope. Nope. Nope.
Alright, you can put your shirt down. I'm going to assess your heart sounds now. Okay, your shirt. Everything sounds good. There's no murmurs, no irregularity. And now I'm going to check her heart rate at the point of maximal impulse. Good. 62. Now we're going to go with our lungs. So we're going to just have you sit up over here, please. Okay. Start off anteriorly. Can you breathe in for me? Deep breath. Breathe out. Breathe in for me. Breathe out. Breathe in for me. Breathe out. Breathe in for me. Breathe out. Lungs are clear bilaterally. Yeah. I can just have you, I'm going to come around and listen to your back. I can just have you breathe in for me. Breathe out. Breathe in for me. Breathe out. Breathe in. And breathe out. Good. Everything's clear bilaterally. You can lay back down now. Alright, we're going to move on to your lower extremities. So if I can just lift the blanket up. Okay. You're checking their skin, the hair, to make sure there's no lesions, no edema, make sure there's no patches of hair missing, which could indicate arterial problems. So I'm going to check your range of motion in your feet. So I'm going to lift your feet. Is there any pain? No.
Nope.
Can you bring it out like this for me? Okay. Now, our side. Can you swing it to your side? Okay. We're going to do the same thing for this leg. Always do everything bilaterally. Any pain?
No.
No. Good. Swing it out this way for me. Good. Okay. You're going to check her capillary refill and her pedal pulses. And capillary refill is good, less than 2 seconds, and her pedal pulses. Good. Now we're going to move on to the focus assessment with the head, neck, eyes, and ears. So if I can just have you sit up and swing this way for me. Okay, we start by making sure the face has facial movement, symmetry, and is appropriate. So can you move your face? Good. Our face is symmetric, good movement, everything. Then we're going to check for TMJ. So if I can just have you open your mouth, close it, open, close, now side to side. Good, no clicking. So it's negative TMJ. So then we're going to move on to her skull to make sure it's contact, make sure there's intactness and contour. Everything's good. And we're going to move on to, and her hair is appropriate. There's no baldness, everything is fine. We're going to move on to our temporal and carotid arteries. We're going to palpate it. And also, I'm going to listen and auscultate to make sure there's no bruise. And do everything bilaterally. Good. Now, her head's in an upright position, and now I'm going to check her trachea, so I'm going to come behind her and make sure it's midline, not deviated. Her trachea is midline. Good. So, we've already done the range of motion on the head when it came to the general assessment. So now I'm going to get my pen light, and we're going to check for corneal light reflex. And we're going to stand 12 to 15 inches away from her, and you're going to shine the light at the bridge of her nose, and to make sure the light is symmetric in both corners of her eyes at the cornea. Good. Now, we did Perla, checking for the pupils are round. Pupils are equal, round, and react to light accommodation. Pupils are equal and round, and we did the light accommodation. Can you stare at my finger? Now can you stare at the wall? Good. Now we're going to move on to the ears. So we're going to get the otoscope. And we're going to start by checking the alignment of the ears. The ears are in line, appropriate size, shape, and they're symmetric. So, when checking for the ears of an adult, you pull the pin up, and back. And I'm checking to make sure there's no cerumen impaction or there's no perforation of the tympanic membrane. I'm going to do everything bilaterally. Good. And to finish off, we're going to do the Weber and the Rhines test to make sure she can hear. But before that, we're going to start off with the whisper test, which I'm just going to whisper a word behind her ear and make sure she can repeat it to me.
Cat.
That's correct. And make sure it's bilateral. So I'm going to do this ear as well.
Dog.
Correct. So now we're going to move on to the Weber and the Rhine test. So we're going to get this, and we're going to hit it and make sure it vibrates. And we're going to start off, we're going to put it on the top of her scalp and make sure she can hear equally in both ears.
Yes.
Okay. Now, tell me when it stops.
Stop.
Okay? Now tell me when it stops. We're checking for air conduction and bone conduction to make sure she doesn't have any sensorineural or conductive hearing loss.
Stop.
Okay? Now I'm going to do the same thing on this ear.
Stop. Stop.
Okay? We're going to move on to the mouth. If I can have you open your mouth. Okay? I'm going to get my tongue depressor. I'm going to get my light. I'm going to look to make sure there's no lesions, there's no redness, edema. Good. Can you say ah for me? Good. And doing this, we're checking cranial nerves 9 and 10. And lastly, we're going to check her lymph nodes to make sure nothing's swollen, they're not easily palpable, because in that case that would be bad. So we're going to start down here. Do you have any pain or tenderness when I do this?
Nope.
I'm going to come around the front and get her post and preauricular lymph nodes. And it's not easily palpable, there's no swelling. I'm going to come down here, get her retropharyngeal lymph nodes. No pain?
No pain.
No pain. Okay. And that is the focus assessment for head, neck, eyes, ears, mouth.